Do you have a child or client with autism or toddler showing signs, and you are wondering how to get quote unquote good therapy in place? Today, we are talking about the 5 questions, the top questions we get about how to find good therapy, whether it's good early intervention therapy, good ABA therapy in the home or in a clinic, or school therapy. So let's get to this really great episode with Kelsey General and I talking about the top 5 questions about this topic. Okay, thanks for joining us today. We are covering the top questions, the top 5 questions we get about how to find good therapy for children with autism and toddlers showing signs. I have Kelsey General here with me, and we're going to just hop right into it, right, Kels?
Oh, yeah, we're ready to go. We have a lot to cover today, so get ready for a filled episode. So, our first question is, my child is showing signs of autism. How much therapy do they need? They already get 1 hour of speech. What else can we do?
Yeah, so most of the people that are listening are in the United States, although we have a worldwide audience. In my online courses, I have participants from over 100 countries, so we definitely have people listening from all parts of the world. However, if you are in the United States, which the majority of you are, there is a free evaluation process and free or very low cost early intervention services for any child with any delays, or even if you think they have delays or differences, or you're worried about autism. So you can find where to go, because every state, every city, every county has a different organization that is in charge of the funding for this. And the other important thing is birth to 3 little kids. So premature babies get set up with early intervention right away, even before discharge in many cases. But if you have a 1 or 2-year-old under the age of 3, you can call an organization that you should be able to request. So in this situation, this person already has 1 hour of speech. That could be through the Birth to 3 or the 3 to 5 organization. Or it could be a private speech therapy situation where your insurance is covering or you're private paying. But if your child is showing signs of autism, and in my book, Turn Autism Around, I have chapter 2 is all about the signs of potential autism, but it really doesn't matter. They still need a lot more than 1 hour of speech a week. Kids actually need, all kids, especially kids with any kind of delays, need engagement during most of their waking hours, which is about 100 hours per week. So if you think about like trying to keep your child engaged for 100 hours per week, that's a ton. So you definitely want to look into having an evaluation to see, like, maybe in this situation where you have 1 hour of speech, maybe call that Birth to 3 or 3 to 5 organization and see if you can have an OT, occupational therapy eval, a physical therapy evaluation potentially, a teacher evaluation. If you never got a multidisciplinary evaluation, like when Lucas was young, my son with autism, when he was 2, he was going to private speech therapy. But then we got speech through the Birth to 3. And then it was like, I think it's more than speech. And that's when we requested a multidisciplinary evaluation. The other tricky part is once a kid's 3rd birthday hits, then it's a different organization. And so kids like Lucas who get diagnosed with autism, or even kids with speech delays, tend to get stuck by having to switch from home services to school services, having to switch people. it's a very confusing time. It doesn't really make sense. And I know Kelsey's in Canada, which has their own mess of a system. And so anywhere you're listening, it's a mess of a system. But the one constant, and I do want to end with this and see if Kelsey has anything to chime in, is whether it's autism, signs of autism, or just speech delays, there's a lot you as a parent or an early intervention professional can do to learn proven strategies, like taking my online toddler preschooler course, where half of our members do not have a diagnosis of autism for their child, because it really doesn't matter. It's the same step-by-step procedures.
Yeah, I agree with you, Mary. And for anyone listening outside of another country, you're right, Mary. Brentley actually received early intervention in the States. However, in Canada, it is far different. The number one tip I can say is if you're seeing signs and you're in a country where they don't have early intervention like this, join a local autism group, because those parents have all had kids who were developmentally delayed, even if they went on to get a diagnosis, and see what the process is in your area, because moms are normally the best source of information. And also make sure to look into the online courses, because we would have been in a whole different situation if I didn't learn exactly what to do, because you're not always going to get the amount of therapy that you need.
Right. And you can always call your pediatrician or your school district to find out where to go if it's confusing, if you can't Google and find the information quickly.
Yeah. So let's move on to the next thing. So now my child just got a diagnosis. I heard they need ABA therapy. How much ABA do they need, and what does that look like?
Yeah, so ABA is applied behavior analysis. It has been for over 2 decades the most proven treatment for children with autism. It still remains the most evidence-based process and therapy for children with autism. So usually you can't get ABA therapy unless you have a diagnosis of autism, which is his own mess, because kids with early signs of autism can really benefit. And that's one of the beauties of my online course, because we teach the same procedures whether you have a diagnosis or not. So ABA can look very different. Kelsey, for instance, when her son was diagnosed and she moved back to Canada, she was driving Brentley each way, an hour each way, to a clinic that had a board certified behavior analyst like I am, and was doing, quote, ABA therapy. But they were working on the wrong things in the wrong order, colors instead of working on manding and requesting things. And they were also, Brentley was also having extreme problem behaviors, eloping, hitting his head on hard surfaces, and it wasn't going down. So that's an extreme situation where ABA, and it's not that these people were malicious or wanted to do any harm. They were trying their best. Insurance was paying. They were, really trying, but they didn't know positive, child-friendly early intervention techniques that were also ABA techniques that treated the family, the parent as the center, the child as the center, and really empowered parents to become the captain of the ship, and really was open to becoming that team that really could make a difference. So in my opinion, ABA therapy, and I've seen lots of ABA therapy. I've been a part of my son's ABA therapy from the start, and thousands of kids over time. I was the lead behavior analyst for the Pennsylvania Verbal Behavior Project for 7 years. I saw a lot of kids in a lot of classrooms. So in my opinion, good ABA, if I just did a one-to-one coaching call, which I don't do many of. I've been starting to just dabble in that, but mom was there, dad was there, their BCBA was there. I didn't actually see their ABA therapy, But the fact that mom, dad, and the BCBA were present for the 3-hour coaching call, the fact that we were able to have an open dialogue about teaching carrier phrases or teaching colors or what to do when he escaped from the table, and the fact that she was revising goals as we talked. She was talking about the RBT could work on this and the RBT can do this. I felt very confident that you don't have to have all the answers, but let's be open. Let's have positive, child friendly, making progress, seeing data to show that they're making progress. And this can look different in the home, in the school. I did another podcast video on school versus home ABA. We can link in the show notes too. Kelsey, I'm sure you have things to add.
I do have things to add. When we get this question all the time about, what is good ABA, one thing I always say is no therapy is better than bad therapy. However, which means you want to find a good provider, and if you cannot find a good provider, you want to rely on learning things like in Mary's courses and doing it as much as you can by yourself at home. However, kids need to be engaged all waking hours of the day, especially young. Having them in at least 15 hours of therapy, if you can find it, is really the best. And when I think about good ABA, I think, like Mary said, someone who can collaborate with you, someone who listens to what you want. I remember taking Brentley. I never went to this therapy provider, but I went to this one clinic to tour it. And they said, okay, well, we work on 21 goals across 7 domains, this many in each one. And I was like, okay. And it was like lacing and cut, whatever. And I said, okay, well, I'm a single mom and I need him to walk into a store because right now he cannot. And I need him to stop hitting his head on the floor because right now he's doing that. So what are we going to do about that? And they go, well, that's not in our 21 goals right now. So we're going to start with these 21 goals. And so that was an example of a therapy provider who's not listening to you. And so, but if you can find happy people who are willing to collaborate with you, are willing to, learn, that's the best option. If you're not comfortable with something happening, whether your child has autism or not, speak up. An autism diagnosis doesn't mean you don't know how to parent anymore.
Right. And in our course, we talk about for the toddler course, getting 15 minutes of table time a day by the end of the 60-day access. And then you move on to the bundle and you learn to expand and everything like that. But one of the things I want to be clear about is if you have a child diagnosed with autism, you're going to need more than 15 minutes of intervention a day. And you're going to need a lot more than 1 hour of intervention a day. And I think I want to make that very clear. Like we do need to be finding agencies, finding people that can deliver 20, 30, even 40 hours of therapy a week. And that sounds extreme. And that Lucas got 40 hours of therapy a week back more than 2 decades ago. And it was a lot. It was like, oh, wow, I want my child to be, have a normal life or have I just want to be the parent. It's like, well, unfortunately, the diagnosis of autism means that you have to intervene. Now, if you have a 18-month-old, 2-year-old with a new diagnosis and you start intervention and they explode and with all good language and that sort of thing, maybe you don't need 30 hours or 20 hours. Maybe you can do it yourself or hire a nanny or hire a college student to do 5 hours of intervention a week. I'm not saying everybody needs this, but I just want to be clear that we're talking about, with a diagnosis of autism, and most states do provide coverage for ABA therapy, which is also good. And ABA is a science of changing socially significant behavior. So ABA should not just be child friendly, it should be working on systematic procedures to increase talking, increase eating abilities, increase potty training, increase self-care, increase imitation, language, social skills, while decreasing problem behaviors. And that's what we need to look at in a positive, child-friendly, parent empowering process.
Yeah, I agree with everything you said. And again, never be afraid to speak up if you're not comfortable with something, and ask questions. Which brings us to the next question. What question should I ask a therapy provider to know if they're a good fit? Whether that's ABA, SLP, OT.
Yeah. So I think you should ask, you know, how they work, if they let you observe, if it's a SLP, for instance, if they have you sit in the waiting room, which I do not recommend for any child. You should at least be able to view within a two-way glass for, private speech therapy where you're going to a clinic or a hospital. ABA centers, I mean, they're not gonna let you observe every day, obviously, but you should be able to get input, observe for, can you observe for an hour once a month? Can you observe for 15 minutes when you drop your child off? Can you see videos of him interacting with his therapist there? Can you, like some daycares, if you think about like the daycare industry, I know we did, a few podcasts with Rachel, who's our program director. Her son Everett just started daycare at a new daycare center. She can have all day long. She has cameras on, right? She can peek in. She can get updates. Like that's the kind of transparency we need to have with kids who can't tell us what's going on. So, and I think COVID kind of hurt that too, well, we don't allow, visitors. Before COVID, it was like, well, confidentiality with the other kids. And, you know, I'm sorry, I'm not sending my child somewhere unless I observe first and decide if this is going to be a good setting. So it's not just, excuse me, it's not just them telling me what they're doing. I want to see it. I want to see it before I decide if this is a good placement or not. I would ask what happens if a child misbehaves, looking for like timeout, looking for, if you're observing without your child there, looking for, are they talking positively? Are they giving those 8 positives to every negative? Those sorts of things. Yeah. So when I went to see this proposed placement for Lucas and he was just about to turn 3 or just turned 3, and I went without Lucas, which I would recommend. Like, if you're going to go tour somewhere, don't bring your child who needs your attention, go. And I was looking and they had kids like taking off their shoes and running around and it didn't look like anything was really happening. And I remembered like one of Lucas's problem behaviors when he turned 3, when he was diagnosed, was like he would take off his shoes and socks and then he would strip down into his diaper. And so I was just like, okay, so if somebody's not with him, he's going to strip down. Like, what are you going to do about that? And they're like, I forget what they said, but I mean, I came out in tears. Like, there's no way I can have Lucas go there. Like, and that's fine. You need to look and decide and ask questions like, what happens if there's problems? How do you communicate with us? Like, how do I know if he had a bowel movement? How do I know if he had intensive teaching? Look at the schedule, ask questions of, one of the reasons I rejected that site and the next site was they were going to do like 15 minutes of intensive teaching a week. I'm like, what? Like, studies show that he needs 40 hours of intensity, and you're telling me he's going to go 15 minutes a week? I asked about recess, and one of the sites was in such a bad area that they couldn't bring the kids out because it was like a gun zone. I'm like, what? Like, so just ask questions, make a list of questions before you go. Try to be positive with them though, because these are well-meaning professionals and people caring for kids. And just because it's not the right fit or you see something different, you know, always go in with a positive attitude, but look critically.
Yeah, I'd agree with everything you say. My top question I'd ask people are, especially now going through your courses, would be like, we do, and now that I'm the captain of the ship, we do this at home that works, we do this at home that works, but we really need help with this. And if it's a good provider for me, they're going to respect what does work. They're going to listen to what does work. And they're going to try and incorporate that while also helping me with maybe things that I haven't figured out yet. And if you can figure out if a provider really respects your values and your thoughts as a parent, and is wanting to collaborate, you can work with that. If you say, I really don't like edible reinforcement, I don't want to give my child, edible. If a provider's like, well, no, that's what we do, that might not be a good fit. But a provider is like, sure, we have lots of ways we can reinforce your child, that might be a good fit.
Mm-hmm.
So those are some of the questions that I would ask to kind of see where that's at. And a big one, like Mary said, what happens if my child doesn't listen? What happens if my child doesn't want to do that activity? Are they going to be, forced to do that activity, or used escape extinction, which Mary talks about in episode 7 of the podcast. So you can learn more about that there. Or are we going to say, well, that's a teaching error and we need to figure out our reinforcement better? Those are kind of the two answers we might get there. So,
And also look at something Kelsey said that makes me think of this. Also look at the recess yard. Is there a fence? Is there safety issues? Like if the door's open and there's no gate, which normally is like required, but nobody's escaping from the class, but bringing, from the tour, like Lucas or Brentley would be out of here. Like, how would you deal with that? Or, the fenced in play yard and stuff like that. Look for safety issues too.
Yeah. So that brings us to our next question, which is, now we've talked about all this, how do I find therapy near me, or therapists who are using child-friendly and positive techniques like you talk about?
Yeah. So this is a big problem. And, we get this question every day. Like, how can I find professionals that know your approach, Mary? So it's tough. Because even though I've had thousands of people go through my courses and started a train the trainer in the spring and early summer. So we have one cohort through. There are very few professionals who really know my approach well enough to help families. So, and my courses are for professionals too, with behavior analyst credits and early intervention credits. So that is my goal, to attract more professionals who are going to take my approach seriously to really help families around the world. But for now, I usually tell people to Google, to search autism, ABA, verbal behavior. Like my first book, The Verbal Behavior Approach, is 2007. Like if you go somewhere and they say, oh, we do, more traditional ABA, we don't use verbal behavior. No. They have to at least be using verbal behavior, at least do the BB map. So I would search autism, ABA, verbal behavior, VB map, and then I would search the city and state, Boise, Idaho, Dallas, Texas, wherever. Or if you're in another country, try to do the biggest city and the country. Then that should produce something, right? And then some at the top might be ads and might not be in your county. So just go through and see. So we did this the other day, and we got 3 places in the city and state we were looking for, 3 bigger organizations. Then at that point, I would look at their websites, do about us, look at their services. You know, sometimes, a lot of times now, they have to take your insurance. They have to not have a wait list. They have to be serving kids in your age range or in your specific area. So it's really like uh, a process. But then once you get a couple places, if you can call them or fill out their contact form and see if you can get an interview or see if they're taking kids, and then try to get at least 2 that you could tour and pick one. Um, that would be one way. Another way would be, like Kelsey said, network with parents in your area and see what they would suggest. Um, and the other way is just to learn yourself and then to home grow your own. um, which, you know, you can find great people on care.com and Indeed, and you could, especially if you money is not an issue, you can build your own team and like Kelsey experienced online consultation with a BCBA. Um, and that's helped her kids a lot because she wasn't able to find local providers.
Yeah, that would be everything Mary said, to find local providers. And if you can't find anyone locally, don't give up. There, especially after COVID, tons of large ABA companies and large therapy companies are doing telehealth services, especially if you're in another country. You could look into that option. And that's usually more of a parent training. So you would still probably want to look for a nanny in your area, you know, mother's helpers, someone who you can also train to support your child, because it's a lot of hours on you. And I did it for many years, but now we have people in, and I normally actually just find them on regular childcare sites,
Mhm.
people who are fun and love kids, and just train them via our online BCBA and through Mary's courses. So there are options if you can't find anything, but the first step is to try and find someone local who can support you.
Yeah.
Yeah. So that brings us to our last question. What should I do if my therapy provider that I'm currently with isn't good?
Yeah. So I actually addressed this question the other day as well. Um, so this individual had a speech therapist through early intervention coming to her home every other week for an hour. Um, and wasn't really adding to the team. She also had a BCBA and an RBT, and she's in my courses. And so, like, so now you have this person coming, well meaning professional, highly credentialed, coming, but not adding things and actually making more of a mess of things. Like maybe she wants to add carrier phrases, which we don't recommend. Maybe she wants to, you know, but this child that we were talking about has big articulation issues. So for me, I would want access to a speech pathologist who really was able to provide the team with that expertise of, like, I don't know how, you know, where my tongue goes for an L or a U, or, you know, these speech pathologists have that very fluent, right? And they can help shape articulation. That's one of the many things speech pathologists can do. But if they aren't familiar with an ABA verbal behavior approach and they're coming in with outdated techniques, they're really, you know, so mom said to me, well, should I just tell them not to come? And I said, no, actually, don't tell them not to come. You want to call your case manager or put it in writing and say that this particular provider is not the right fit. I need somebody who knows about behavioral therapy, who's willing to be part of the team, who has expertise in articulation. And for this child, his articulation was pretty severe. And I said, maybe a Talk Tools certified professional SLP. So I went over with her how to find Talk Tools, speech pathologist um, in her city and state. Maybe she could find somebody. Maybe they have contract with their birth to three agency. But, or even just, she said, well, the case manager said, like, this was the only speech therapist. She was surprised that we could even get a speech pathologist, that normally you just get a teacher. But she also got this early intervention service started before the child's diagnosis. So I recommended that this mom looked into OT and PT evaluations to see if he needed weekly. Also, maybe a teacher would be better than the speech pathologist. We just need people that are going to be adding to the team, not taking away from the team. I had another mom who sent away an RBT because they, quote unquote, didn't know what they were doing. I was like, don't do that. If you have a person show up at your door with, that's an RBT that's had 40 hours training and passed a written test with no experience, with a high school diploma, with anything, or you have a mommy's helper or a college student show up at your door with a smile on their face and are willing to learn, you don't want to turn people away like that. And even the speech pathologist, maybe a sit down and being like, listen, we need to work on X, Y, and Z. How much expertise do you have in this? And maybe that person has ideas. So I wouldn't be too quick to label things bad or people bad or organizations bad. But like in Kelsey's situation where, they were like, well, if he stays here, you need to stay out of the clinic, Kelsey, because we don't want to know it all, mom. And he's 2.5 and he's banging his head so much that he's going to have to wear a helmet here. There are times when you just need to bolt.
Yeah. Yeah. And it's a hard decision. And that's where you need to really trust yourself as a parent and trust that you know what's best for your child. I will say, so if you're in a setting that you think is bad, maybe he's going to center, maybe he's crying every day at drop off, and you're like, I think this is bad. Step one is probably to ask to see what's going on in the center. Try and pair with that staff, like, oh, I really loved when you did this, but like when Johnny fell to the floor, like, I wasn't sure why you did that. Like, can we talk about that, or try and problem solve with the staff and see if they're willing to listen and collaborate with you. If they aren't, it might be time to look for something else. If you're not comfortable with what's happening and it's really bothering you and your child, it might be time to look for something else. But in the meantime, I'd make sure you take something like Mary's courses to learn how to support your child at home and train everyone around the child while you look for other services. We don't just want to remove children from all therapy and just hope for the best. That's not it. But we also don't want kids in therapy where they're crying, where they're not happy, where goals aren't being met. When you look at the data, if you've been working on reducing a problem behavior for 6 months and it's the same or getting worse, what are we doing here? Yeah. What's the plan? Yeah. So those are the things I would do if your therapy isn't good.
But yeah. And I really agree with everything you're saying, Kelsey, and it's also reminding me that you can always call an IEP meeting. You can always call your case manager. If you're going to an ABA center and there's a behavior analyst who did a BB map, you can always call a team meeting. Don't struggle for too long. And everybody out there is trying their best and they are doing what they have been taught. And, I just would try to be proactive, try to pick the right places to have your child go. But, sometimes you have to really just kind of develop programs. Like my particular school district where Lucas went wasn't known for special ed. And trust me, I've had to, advocate heavily, especially in the beginning. But, you can have things happen to move whole programs forward, not only for Lucas. Like I feel like I helped create a great program for Lucas, but also for other kids throughout the county, throughout the state, and forever. Once we start raising the bar for our children, we also raise the bar for other kids. So I think that's a good way to end it. Thank you so much, Kelsey, for all those great questions. And we will be back same time, same place next week.